Hello, my good people. Welcome back to Samuja YouTube channel. I'm really grateful for your support, words of encouragement through comments, and I believe together we are learning. We are still on our phase one of social issues that are affecting our community, and today I would like us to talk a little bit about stigma associated with mental illnesses. When we talk of mental illness, these are disorders that affect our mood, thinking, and behavior. If I am mentally sick, I don't think or act or maybe behave like that same person. This is because it's something that is disturbing my mind. I have that disorder that is making me not see things the way they are supposed to be, or maybe behave or have a mood that is consistent. Sometimes I become maybe angry at a very high level, or maybe become depressed, or maybe isolate myself, or maybe I don't talk to anyone. I feel I lose interest in things that I used to love more or maybe do. So these are mental illnesses. When we talk of stigma, we talk about attitude, behavior, and beliefs. Now, attitude towards mental patient. If I show that mental patient a negative attitude, that they are not supposed to come close to me, they are not supposed to be in the same class or maybe same place that I am, that makes them feel bad, and they will never be able to get help or ask for help as a result of just the way I have treated them. They feel like they are lesser human beings, or because they are sick, because of the attitude that I have shown them. And also the way I behave. Maybe I feel I behave in a manner that shows them that I'm afraid of them, I disgust them, or maybe I don't feel comfortable around them. Just the way I behave makes them also uncomfortable. And if they want to approach me, they wouldn't approach me at that particular time, or maybe at that particular moment, or maybe when they go to another person and they are shown the same kind of behaviors and attitudes, they will not be able to speak up about their mental issues or what they are going through in their lives. Another thing is about belief. What do I believe about a mental patient? A mental patient, maybe some people believe they are dangerous, they are kind of criminals, or maybe they're just pretending, or they're just being naive, or maybe not, they don't want to adhere to societal norms. That belief makes stigma more concrete or more strong, and they will not be able to seek help as a result of what we believe about a mental patient. And also, when we come to structure, how do we treat mental illnesses? Do we treat mental illnesses as like any other physical illness? Mental illness is the same, or it is equal. We should treat it with equality like any other physical illness, because there's no health without mental health. You might be sick in your leg, stomach, and then you find someone who is mentally sick. We should treat them equally. So if that does not happen, it creates a lot of stigma, and even them going to seek help to professionals, they feel uncomfortable because of the way they'll be treated. When we look years back, if a person mentioned, for example, Mathare Mental Hospital, people would definitely know that is a mad person, the way they used to associate that hospital with mad people. We should be mindful of language. We should be mindful of how we term those people. They're just people who are struggling with mental disorder or mental illness, not mad people. If we label them, when they pass by and you say that's a mad person, they feel bad. Remember, even before they were sick, they were human beings. And even now they are sick. They have not stopped being human beings. So they have feelings. They have feelings. When you talk about them being mad, being dangerous, being people not worth to be around them, it hurts their feelings. Despite their condition, it hurts their feeling. The society tends to blame mentally sick people. Maybe some of them, they blame them, telling them that they brought them this on their own. For example, if a person was using drugs and they have developed that problem as a result of drugs, they point fingers at them. They point fingers saying that this person, they just wanted to be the way they are because they used to use drugs. Now, next video, we talk more about addiction and see how addiction starts. Before we start blaming them, now they are sick as a result of substance abuse. Stereotyping people is another thing. These are mad people, they are dangerous, they are violent, they are ever angry, they are lazy, they are all that, blah, blah, blah. When we start stereotyping these people, they will never get better because they will never seek help. So as I am pointing fingers at them, I should also point fingers at myself. What am I doing, or what am I doing to make them seek help? Cultural beliefs are there. This person was bewitched. This person didn't do that. This person did that. Pointing fingers at cultural beliefs. Mental illness is mental illness. Just like you have malaria or you have pneumonia. It's just like any other disease. And it should be treated professionally. They should seek help. And who's to motivate them to do that? It is me and you. To motivate them to seek help. How do I motivate a mentally sick person to seek help? Number one, let me talk openly about mental illness. Everybody in this world is going through some stress, some kind of mental problem. But the degree is what matters a lot. Maybe mine is stress, but someone else is chronic stress. Mine is just a trauma. Another person is chronic trauma. We are all disturbed in one way or the other. Let me talk openly about mental illnesses and also about stigma associated to this mental illness in the open. By doing that, our people will be able to understand what they are doing to mentally sick people or people struggling with mental illnesses. Number two, let me educate myself and others about the consequences of stigma in mental illness. Let them understand, or let me understand that today it is me, tomorrow it might be you, tomorrow it might be your family member, and when we stigmatize them, it affects them physically and emotionally. And they continue sinking deeper and deeper in that mental condition. Number 3, let me show them compassion. Love unconditionally. Some people say you only laugh at a person struggling with mental condition when he or she is not your relative. We are all our brother's keepers. Let me treat that person as my own brother, as my own sister. What I wouldn't want my sister who is struggling with mental problem to be done to, let me not do it to another person. Showing that compassion. Some they normally come to you just for 10 shillings or maybe for food. But how do you treat them? You chase them away. You as if they are smelling. You don't show compassion. It is me and you to show them compassion. Yes, they are sick, but they need you and me. Yes, they're sick. They're struggling with this condition, but they need your love, your attention, your care, your respect, everything. Show them compassion. By doing that, they will be able to open up about what they are going through, and you will be able to, take them or maybe help them, assist them to get help. Number 4, choose empowerment rather than stigmatization. Empower them through words of encouragement, through supporting them in any way you can rather than stigmatizing them. By doing that, it's also a way of showing compassion. There are many people who are out there. Yes, they're struggling with a mental health condition, but they can do something for themselves. They can help their families. But if we don't empower them, if I don't empower them, who will? If I don't empower them, the society will continue to suffer because today's me, tomorrow is you. Together, we can be able to eradicate stigma. Number 5, let me be mindful of my words. What I say to people struggling with mental health conditions. Do I curse them? Do I bring them closer to me? Do I talk in a language that hurts their feeling? Do I talk in a manner that they feel lesser human being? Let me be mindful of what I say to them. And not only them, even their own families. Because another thing that has made people not seek help, they hide their people who are struggling with mental health condition, is because of the labeling. That's a family of mad people. It's family caste. That family is blah blah, I know that. But excuse me. How do you, or what do you see when you see these people? My parting shot. It is me and you to eradicate stigma in our society when it comes to mental health. It is me and you to empower those people who are still struggling with mental health conditions. They are not lesser human beings. They could be your brother, they could be your friend, they could be a family. They are in our society and we need them. Always remember that when you point a finger at a person, 4 fingers are pointing at you. Treat people who are struggling with a mental health condition equally. There is no health without mental health. And it is always okay not to be okay. Not every time things are 100% sure, okay. When we get to understand that, me and you, we are going to live a healthy society, an open society, a society that is ready to help people who are struggling with mental health conditions, and create an environment where everybody will be free to speak what they are going through. Thank you so much for watching. Please like, share, and let's learn together. We shall continue with the first phase, dealing with social issues that are affecting our community. See you in my next video, and thank you very much.